Hi friends, I am Dr. Pratap Singh Rathod. I have done MD in Physics Medicine, and today we will discuss about localized effects of heat, that is the burns. By definition, burn is an injury which is caused by application of heat or chemical substance to external or internal surface of the body. So whenever there is an application of localized heat on a particular part of the body, it may be external or internal, it causes burns. There are different characteristics of burns or types of burns. One is contact burn, where there is a physical contact between the hot object and the body. So when applied momently, it produces disturbed erythema and corresponding to the shape and of the agent. So if there is a hot rod placed on the skin, it produces the linear markings on the skin with erythema and blister formation around the iron rod. Next type is the flame burns caused by the active flames. So this is actually contact of the body with the flames like candle burns, gas burns. It may produce vesictions, singeing of the hair. So singeing of the hair is the where the flames, when hair comes in contact with the flames, they become curled, twisted, and blackish. So end of the hairs becomes curlish. So this is typically seen in the flame burns where the hairs get singed and they break off, become totally destroyed. This is mainly because of the keratin which is present in the hairs get coagulated, gets curled up. This is characteristic seen in the flame burns. Next is the scalds. These are caused by contact with the hot liquids or chemicals, most commonly the water. They usually occur on the exposed part of the skin. Next type is the radiant burns. So not it is this caused by heat waves. So localized application of heat waves or hot objects radiating heat waves may cause the heat burns. So there is no contact between the body and the hot object, but just a radiant heat. Next type is the ionizing radiation burns. So these are caused by the radiations like X-rays, uranium, radium, or UV rays. It can be localized or massive, may involve the whole body depending on the radiation exposure. In this, there is dermatitis, inflammation of the dermis, then shedding of the hair, and epidermis, pigmentation of the surrounding skin is seen in these cases. Chemical burns, these are caused by chemicals. It may be divided into as acid burns, alkalis, or vesicants, or certain plant which can cause irritation on the skin and may look like burns. So vesicants causes blister formation. These are mainly chemicals which causes damage to the body similar to burns. Characteristically, there are ulcerated patches. There is no blister formation. Hair is not singed, and there is the red and line of demarcation of the skin is absent around the burns. So usually they, because of the strong acids, alkalis like acids like HCl can cause the skin to get ulcerated and part of the skin gets sloughed off because of these chemicals. Then there is electrical or lightning burns. These are caused by high voltage currents. Electric and lightning burns, they may enter the body. So though in the point of entry and the point of exit, there is burns, localized burns, raised skin is seen in the entry wounds, and there is the exit wound, there is depression is seen. Microwave burns caused by the microwaves. With these waves creates a heat through the molecular agitation of the water molecules inside the objects. So as the body contains water molecules, the water molecules gets agitated and they, when they get tied to escape, may cause skin burns. Then coming to classification of burns. So this is a classification based on the degree or how much the damage it causes to the skin. So whatever the damage to the skin, damage to the body it causes, the burns is classified. There are different types, different forms of classification is present like Dupton's classification, Hebba's classification, Wilson's classification. Then there is Evans classification, which divides the burns into superficial, partial, and full thickness burns. Coming to difference classification based on degree of damage. So if you take the consider the skin damage, which skin to body damage caused by the burns, different classification. Dupton divides the burns into 6 degrees. 1 to 6 degrees it is divided into 6 degree. So first degree is the erythema, where there is just redness around the skin is present. There is no burns is present. Then second degree, there is vesication with blister formation. So there is presence of clear fluid inside the burns. The skin, there is elevation of the upper layer of the epidermis with vesications and blister formation which contains the serous fluids. Then third degree burns is a destruction of superficial skin. So the epidermis gets destroyed, and but the skin is remain the intact. Underlying subcutaneous tissue is present, but superficial skin is get destroyed. Then destruction of whole skin including dermis, that is a 4-degree burns. There the damage extends up to dermis. Then when the damage extended up to deep fascia and muscles, it is 5th-degree burns. And if it extends beyond that to the bones, it becomes 6th degree. It is complete charring of vessels, nerves and bones. So this is the 6th-degree burns. So similarly in Wilson classification, this can be divided into epidermal, dermoepidermal and deep burns. So epidermal includes the epidermal damages, including vesication and blister formation. Dermoepidermal includes the dermis as well as the epidermal damage. Then deep includes the muscles as well as the bone damage. In Hebers classification, it is divided into 1st degree, 2nd degree and 3rd degree, similar to that of Wilson's. So 1st degree involves epidermal, 2nd degree involves dermal and epidermal, 3rd degree involves the deep, includes the muscles and bones. So now coming to usually modernly nowadays we divide the burns into 1st degree, 2nd degree and 3rd degree based on the involvement of the skin layers, which is superficial burns. 1st degree is superficial burns involving only the epidermis. Here there is red pink in color. They becomes blanches and painful to stimuli. Common example is the sunburns. They usually heal by 3 to 6 days. So they only involve the skin, superficial skin. There is only reddish or pink in color, and they are very painful to touch. And they usually use heal by 3 to 6 days with skin peeling with no residual scarring. 2nd degree burns, they are partial to deep, involves the epidermis as well as the dermis and depth underlying the dermis. They are deep red in color, blanches show blanching, very painful, blisters are usually present. Then there is they heal by scar formation because it extends up to deformation. So there is epidermal damage as well as the dermal damage is seen. 3rd degree burns includes the full thickness burns, involves the deeper structure, that is the epidermis, dermis, muscle, subcutaneous fascia and bone near the bones. They look like waxy white, gray or charred and black in color. There is no blanching, there is no blister formation. They are red, dry, leathery appearances seen. Spontaneous regeneration of skin will not occur. So this usually do not heal by spontaneous regeneration. It usually requires a grafting. So skin grafting is the main treatment seen in this case, since most of the dermis muscle layer is already burnt off. So spontaneous healing doesn't occur, and skin grafting is essential in these cases of 3rd degree burns. Coming to effects of burns. So effect of the burns depends on different factors like degree of heat applied. So effects are severe if heat is applied more. Duration of exposure. So as the exposure is prolonged, the degree damage is prolonged. Extent of body surface involved. So how much body surface is involved affects the burns. So victim may survive based on how much the percentage of body is burned. So this is calculated by use of rule of 9 thumb, also called Wallace rule of 9. So total body surface area involved is worked out by rule of 9. So in this rule of 9, upper limb is 9% of total body surface area, 9% for each front and back of lower limb. So in diagram representation, so there is 9%, that is front and back of upper limbs, it is 9%. Front and back of chest is 9%. So front is 9%, back is 9%. Front of the abdomen, back of the abdomen is 9%. Then front of upper lower limb and back of lower limb is also 9%. Then head and neck is 9%. That is total head and neck is front and back is total is 9%. So totally it becomes 9 parts. It is 80, 90. So for 100%, it requires 81%. So 9% for head and neck, 1% for lastly 1% which remains is the perineum, that is 99%. So there is 99% involvement is seen, and 1% is given for the perineal regions, which causes the 100% burns. So when burn surface is more than 1/3 of the body surface area, then the result is nearly fatal. So if the more than 1/3 of the body surface area is burnt or 30 to 50% burns are seen, the person usually dies because of burns. In children, since the body surface area, body head surface is comparatively more in children's, Lund and Browder describe the method for compensating for the difference. In children who are less than 1 year of age, Head is 18%. They are given head has more percentage, 18% compared to in adults, which is only 9%. Each leg is 14% of total body surface area. Each leg is 14%, and each limb is similar to 9%. But and similar to other things are same as that of adults. So only change is seen in the head, and other changes is seen in the lower limbs. Trunk and arm represent the same percentage as in adults. For each year above 1 year, 0.5% is added to each leg and reduce 1% from the head and neck till the person gets that adult age is achieved. So this rule of thumb is useful for fluid resuscitation in children with burns over 10% and adults whose burn is more than 15% of total body surface area. IV fluids may become needed to prevent circulatory shock. Volume of fluid lost is directly proportional to area of burns. So how much burns is the present is directly proportional to the volume of liquid required for resuscitation. Next effect of burns is thus based depends on the site, whether the burns is in vital areas like head and neck, chest and abdomen, especially anterior wall of the anterior abdominal wall, including genitals and perineum. This area, even with the superficial burns, can cause dangerous then deep burns involving external extremities or back. So sensitive areas like head and neck, even the superficial area is more fatal than the deeper burns in the other parts like in the extremities. In children less than 2 years of age or elderly 90-60 years are more vulnerable to burns. Women are more susceptible to a little bit of burns. Certain history of natural diseases, trauma, electrical injury may also cause more damage to the burns for people who are having some natural diseases, trauma, electrical injury beforehand. Now coming to age of the burns. So we can classify, estimate the age roughly based on the healing stage of the burns. So immediately after the burns, there is redness and vesications. After 6 hours, there is inflammation and volume of neutrophil cells are present. 12 to 24 hours, there is exudates, blister formation gets dried up. 2 to 3 days, there is dry crust with disappearance of red line and sloughing is present. More than 4 days, deep sloughs and pocket of pus is seen. After several weeks, the wound of the burn gets healed by scar formation. Cause of death in burns. Burns individuals develop a host of complications which may be divided one or more which contribute to the cause of death. Mainly common cause is the sepsis, leading to more common causes the sepsis which caused by the multiple organs, multiple bacterial infections which is the leading cause of mortality in burns. So cause of death can be divided into immediate cause, delayed cause and remote causes. Immediately, the person may die because of neurogenic shock, because of pain and fright. Then person may die because of asphyxia, because of suffocation or result from inhalation of carbon dioxide, carbon monoxide resulting from the burn gases, or cyanide or any toxic substances because of burns. So sometimes when the burn because of burns, certain chemicals may be released and it may be toxic and person may inhale and resulting asphyxia. Smoke or heat induced laryngospasm may also cause immediate death. There may be respiratory arrest, may also be another cause. Vagal shock, vagal reflex, cardiac reflex vagal inhibition cause can also lead to death, immediate death. Delayed death may be because of hypovolemic shock because of burns the volume of the body reduces significantly, which may be will lead to secondary shock and person died because of hypovolemia. There may be acute edema of glottis from inhalation of latent smoke, which may cause delayed cause of death. Toxemia due to absorption of toxic products from the burn surfaces may cause delayed death. Sepsis, which is the most common cause of death, which may occur 4 to 5 days to several days. There are other infective complications like bronchitis, bronchopneumonia, enteritis may also cause delayed death. Remote causes seen when the person survives for many days after the burns, like there may be anorexia, the person may not able to eat, hematemesis, that is blood in vomiting, indigestion, respiratory complications or malaria may be present. There may be supplementary discharges from infected burn areas lasting for weeks or months, can result in disease of internal organs and death. So the burns may not get healed properly and there may be chances that internal organs may also get infected. There may be gangrene formation, tetanus, anemia, edema of dependent parts and jaundice may also are the remote causes of death in burns. Sequelae of burns, the burns after because of based on the degree of burns, there may be different sequelae seen. There may be scar formation, there may be keloid formation. Keloid formation is again hyperactivity of skin. There may be marginal ulcers, curling ulcers seen in the stomach because of burns. There may be cornea opacity, which may because of hot air entering the cornea. There may be external orbitation of external artery meatus. There may be joint deformity because of scar formation near the joint. The person may not be able to flex or extend properly. Or ankylosis can also occur in case of burns. Now coming to postmortem examination in burns. Autopsy may not only help determine the cause of death, may also be finding some unsuspected unsuspected findings which may not be detected clinically. In each case of burns, photography is very important for documentation. Some cases of X-ray has to be also taken. This helps in detecting some findings like gunshot wounds, firearm injuries, or fractures. So fracture which may be present because of burns, or sometimes person may have some fight which may be cause fractures which may be detected in the X-rays. Sometimes gunshot or stab may often be identifiable before the burns is autopsied. Coming to external findings in burns, first in clothing. So clothes should be carefully examined, should be carefully removed and examined for presence of kerosene or any inflammatory subjects like petrol or any other inflammatory substances. Site should be clearly seen where the burns are present. Their distribution, extent of burning should be recorded and should be recorded to estimate whether the burn is enough to cause death. So sometimes the person may be killed and there may be just a little bit burns which may not be significant to cause death. Face is usually distorted, swollen, there is singeing is present, singeing of eyebrows may be present, then there is tongue may be protruded because of contraction of the lip muscles and may be typically seen. Skin, owing to effect of heat and blood, veins may stand out leading to marbled appearance. So skin, the veins on the skin may cause a marbled appearance that is contrasting dark and light appearance may be seen. Postmortem staining, which is cherry red in color because of accumulation of carbon monoxide gas, which gets combined with blood leading to cherry red color. Carboxyhemoglobin leading to cherry red color. Kerosene oil, if the person had died because of kerosene oil, the characteristically leaves an odor. Then soot blackening is characteristic of kerosene burns. Antepartum burns, if the person is alive during burns, it shows redness or hyperemia or vital reaction is seen around the burns. Blisters, which may be ruptured or collapsed or fluid filled with fluid may be seen. There may be degloving or destocking, that is completely skin may come off of the body, come off of the skin like a glove, or destocking is seen in the legs, may be seen due to because of cuticle cleaning. Hair may be singed if there is a flame burns or partially or completely burned, completely absent. There may be pugilistic attitude may be seen. So this is seen in many cases of burns where the complete body is burned. This is also called as it is like a boxing attitude, fencing attitude, or defense attitude. It is due to heat stiffening of body. The legs are flexed at the hips, so usually the legs get flexed at the hips, knees get flexed at the knees. Then arms are flexed at the elbows and held out in the front of the body, and fingers are also hooked like a claws. So these are typical findings seen in the pugilistic attitude. This is caused by the coagulation of proteins. So since body is made of, some muscles are made up of proteins, and flexor muscles which like biceps are bulkier compared to extensor muscles like triceps, they get easily coagulated and cause the contractions of the arms. So easily get contracted like thigh muscles or knee muscles and the hand muscles. So all the flexors gets contracted leading to typical features seen in the boxing like a fencing attitude, which is also called as pugilistic attitude, typically seen in the burns. This is seen in both the antemortem and postmortem. So this is not doesn't have any significant medical importance since it is seen in both the antemortem and postmortem, but it is seen because of burns. Heat ruptures, sometimes because of heat, the skin may get ruptured, may get split occurring in the skin due to contraction of heated and coagulation tissues, resulting in which may stimulate like an incised or lacerated wound. So the skin, because of presence of fluid, gets steamed up and they want to escape, they may rupture the skin, split the skin, leading to stretch lacerations which may look like an incised wound. Then there is coming to internal findings. In internal findings, in skull, there may be heat hematoma may be seen, which is a form of artifact and has appearance of extradural hemorrhage. So in the skull, there is formation of the blood vessels get ruptured and the blood gets accumulated in the extradural part of the body. So in extradural heat hematoma, they usually gets diffused around the skull, which can be differentiated between the extradural hemorrhage caused by the rupture of blood vessels, which are usually present localized in the part of the where it is localized. Compared to the heat hematoma caused by burns, they are diffused and usually not localized. Heat may force blood out of the marrow cavity from the calcaneum into the veins from the surface of the dura. Skull bones may be fractured and burst open. Sometimes the skull may get burst open near the suture lines, leading to skull fractures. In the brain, brains are congested and appear swollen with widening and flattening of gyri and abruptation of sulci. Neck, there is hemorrhage in the root of the tongue and neck muscles, which is seen characteristic seen. Then larynx, there may be content of carbon soot particles inside the mucus. And so in the larynx, there may be presence of soot particles, which is typically suggestive of antemortem burns. So if the person is alive during burns, he may inhale some soot particles which get deposited in the larynx, and presence of these soot particles is typically finding of antemortem burns. Next is the pleura. In pleura is congested, inflamed, and with serous effusion. Lungs, it may be congested, edematous, and may be shrunken. Heart, where chamber may be full of blood, cherry red in color because of inhalation of carbon monoxide. Stomach may contain carbon particles because of inhalation of gases. There may be curling ulcers, typically seen in burns, seen in several burnt patients after the person survives. It is seen in the gastric atrium and the first part of duodenum after 72 hours of burns or 3 to 2 days post survival. It mainly because of mucosal ischemia as a result of stress and shock. So because of stress and shock, there is mucosal ischemia leading to curling ulcer. The skin, the gastric mucosa gets ulcerated. Spleen is enlarged and softened. Liver is cloudy. There is cloudy swelling and fatty liver or necrosis of the cells is seen. Kidney shows signs of nephritis, thrombosis, and infarction. Adrenals may be enlarged and congested. Sometimes, typically, if the prolonged exposure of the body to high temperatures along with direct effect of the heat can cause shriveling of the internal organs, which may become firm, hardened, and cooked by heat, which is called as a puppet organs. So inside the body, all the internal organs may get stiffened up because of high temperature and direct effect of the hard heat, which is called as a puppet organs. Heat artifacts. So because of increased heat, certain times certain injuries like splitting of the skin may stimulate like different may cause artifacts which are not cause, but it is an artifact of the other organs. Like remnants of the cloth around the neck may mimic like a ligature mark. Even though there is not ligature mark, it is an artifact caused by the clothing which gets unstuck on the skin. Or the splitting of the skin may simulate like a incised wound or a lacerated wound, though it is caused by the burns. There may be fracture may occur, though person may not have met with any assault, but fracture may be caused with soft tissue hemorrhage may be seen because of the increased heat. There may be bilateral epidermal hemorrhage, which is epidermal hematoma may be formed. As I mentioned, epidermal hematoma caused by burns are very diffuse compared to epidermal hemorrhage caused by the injury. Then there may be shrunken, firm, and light brown in color. Brain may become shrunken or light brown in color. Then the introduction of soot in the trachea during incision of the chart at the neck autopsy may also cause artifacts like adenomatous burns. So during incision, sometimes the soot particles is present on the external may be introduced in the trachea, which may becomes an artifact, similarly like the person may has an antemortem burns. Coming to medical importance of burns, first we have to identify the deceased. So identification becomes difficult as the burns may cause the facial features are lost. If the person has some metallic objects like rings, bracelets, or bangles or keys, it may help in detection of the identity. Sex of the deceased may be determined based on the presence of uterus in females and prostate in males, which gets usually preserved or may last longer in case of burns. Then age of the deceased can be determined based on the teeth. So can also resist burns for longer duration, and if the person has dental record, can be very helpful for determination of identification. Now, determining antemortem and postmortem burns. So, antemortem burns and postmortem burns can be determined based on the inflammatory reactions, presence of lines of redness, vesicle formations, then inflammations are typically seen in antemortem burns, absent in the postmortem burns because of vital reactions. If the person is alive, then there may be soot in the upper respiratory tract. If the person is alive, he may be inhale the soot, that is burn gases, which is seen in antemortem burns. Then presence of carboxyhemoglobin again indicates the person will inhale the carbon monoxide. Then if you take the skin sample, there may be seen enzymatic reaction may be present. Then sometimes there may be gradual healing, maybe sage granulation tissue may also be seen. Cause of death in burns has to be distinguished whether the person died because of burns or other reasons like presence of soot particles. Cellular discoloration will typically say that person died because of burns and not because of other reasons. So again, then burns have to differentiate whether the burns are because of suicidal, accidental, or homicidal burns. Suicidal burns are commonly seen in among women. Accidental burns are commonly seen in children and elderly when they accidentally get burns because of falling off any inflammatory objects. The homicidal burns are quite commonly seen in cases of WD cases where the women are burned by the family members of the husband. Self-inflicted burns to cause any false accusations typically seen in the accessible parts of the body where the persons usually burns their right or left hand and accuse the other person that they caused the burns. So spontaneous combustion is and preternatural combustion is a myth and it is not commonly seen. Dead body of victim may be burnt after death to conceal homicide. Certain homicidal cases, the person may be killed and afterwards he may be burnt. So mainly you have to observe presence of any injuries or presence of any fractures or head injuries, and fetal neck compressions are commonly reported in case of burn injuries, where the common cause of homicidal injury where the person may be typically can be identified. Other injuries like stab wound is very difficult in case of homicide since the burn usually obliterates these injuries. These are my references. Thank you.